Welcome to Transforming and Thriving
with best friends Brooke, Stacie, and Neelia.
Podcast dedicated to women sharing their inspirational stories. Hey there, everyone. We are so excited to be here for another episode of Transforming and Thriving. I'm Stacie.
And I'm Neelia. Today, we have the absolute privilege of sitting down with a woman who is standing in the gap for women during one of the most misunderstood transitions of our lives. Dana Culp is the founder of Thrive Midlife Medicine, a virtual medical practice dedicated to evidence-based care for perimenopause and menopause. Dana is a doctor of nursing practice, a nurse practitioner, and a certified menopause expert with over 25 years of clinical experience. After facing the frustrations of a broken healthcare system during her own perimenopause journey, she turned her personal struggle into a professional mission to ensure no woman has to feel unheard or frustrated during midlife.
Dr. Dana, we are so honored to have you with us today. This is a topic that hits home for so many of our listeners specifically, including myself, as I'm currently in the heart of my own perimenopause experience. So happy to have you here, and thank you for taking the time. How are you doing today?
I am so honored to be with you today and all your great listeners. Doing well.
Happy to hear that. Well, I know we are so ready to dive into your journey and to just hear more about your experience and expertise. To start us off, what would you say is a major transition or life event that you experienced that marked maybe a before and after in your life?
I think that would have to be perimenopause. I have had a fabulous career and built a life that I loved, and it really could not ask for more. And then perimenopause hit. And slowly over the course of a couple of years, my life wasn't that interesting to me anymore, and I gained a lot of weight. I wasn't excited about the things I was excited about anymore. Relationships were suffering. Some low-level anxiety and agitation and just kind of being irritated all the time. And that's kind of how my life started going. And it wasn't until I myself got some help for my hormonal struggles and the lights were turned back on and the music came back on and life became what it was before, that I really realized this before and after that you're speaking about. And that can happen and be very real for so many women. And I think it takes coming out the other side before people can sometimes realize how off the middle their life has become. So I would have to say my own hormonal journey, which is why I'm here today doing what I'm doing today.
That's fantastic. I know everyone has a different way of how they experience this midlife, as you call it. And curious if you could maybe elaborate what you experienced and maybe who you reached out to for help in this scenario when you were going through this.
Okay. Probably the thing I struggled with the most that turned out to be one of the biggest foundations of all of the other changes was sleep. And so that's actually what drove me to the doctor's office is I just couldn't sleep. And I was associating, I'm gaining weight, because I can't sleep, getting, brain fog because I can't think because I can't sleep and so on and so forth. And so I went to my trusted GP, PCP, and your general practitioner that is your main primary care that coordinates all of your care. And and so I went in to see her, a fabulous woman. But she did not know anything about hormonal changes in women in midlife, and I didn't know that. So she took the appointment, knew what the appointment was for, and told me basically she was really uncomfortable in this area and that she would not be able to help me. I waited weeks and weeks for that appointment, night after night, not sleeping. Things are getting worse. I left there in tears, so frustrated and a little bit angry. And I thought, wow, I am basically a colleague speaking the same language as her. I asked for what I wanted. There was nothing she had to figure out, but she was just too uncomfortable. So I left pretty defeated. And I think she realized a big gap all of a sudden. So she then referred me to an OBGYN who I also got pretty unsatisfactory care for, referred me to another OBGYN. And I ultimately changed PCPs. This is now months and months and months. And I came in very educated and very ready to have this conversation, and thank goodness the new PCP, primary care provider, was just so open and so wanting to know and learn and collaborate, and she was able to jump in on my care team and take care of me, and I'm still with her today. She's amazing.
Wow, that's a lot to take in after months
Mhm.
and months and months of not sleeping. And then it's staggering to think that someone with your level of expertise, like you said, you were, on the same playing field or same bandwidth of education, where it sounds like you were somewhat like dismissed by the system initially. I'd love to hear more about that moment of transition, and what was it like when you realized that maybe your mission had shifted to where maybe those first steps, like moving from family medicine to becoming, more of that specialist who focuses 99% of your time on midlife women.
That came over time and then all at once, if that makes sense. So I, over the years, have taken care of, perimenopausal and menopausal women by the guidelines on what the books say, frankly, the old way of doing things. And I didn't know what I didn't know. And so going into this myself and only realizing I had no idea the depth of suffering I was actually going through. I just was focused on, this a couple of things, primarily sleep. And so the difficulty in getting care when I knew exactly what to ask for. I mean, I wasn't an expert yet, but I was pretty confident. I knew some basics at that point, at least enough to get out of this suffering, and not being able to get that care. So I just dove in headfirst and sought out several different credentialing and read every study I could read. I've learned from some of the biggest voices out there, and I feel very comfortable with pretty much any scenario that could come up for any woman in midlife. And so then my practice slowly was changing. My care that I was providing to my patients was different than my colleagues. And then slowly, those women who feel amazing and also feel very heard and feel very much like they have somebody who's on their team, that they have a say also in their care. It's not just, my way or the highway, which sometimes it can feel like that at the doctor's office. Slowly, they tell their friends and their sisters and their aunts, and my practice just slowly became pretty much all midlife women. And as I saw that, it was happening slowly, and then it happened pretty fast where you couldn't get in to see me for primary care for months. And that's when it hit me that I'm just in this little geographical area in this beautiful part of Northern California helping these wonderful women, and realizing, what about all the other women? So, and this is in a practice at a large organization at the time. And so then it hit me. I really felt like just compelled that I had to do more. And I am not an entrepreneur. I am not a businesswoman. I am just a healthcare provider. But I became completely compelled to start my own practice and have the reach as far as I could. So right now, it's a telehealth practice devoted 100% to midlife women for California and Nevada, and we're very quickly expanding east across the United States. So that was kind of a long explanation, but it just kind of snowballed and then just exploded.
Well, it sounds like you listened and you recognized there was a need, and you also transformed your own frustration into a foundation for others using your expertise and experience, and also personal experience of needing more and wanting more. That must have required so much resilience and patience to keep pushing when you felt like there was either just this like lack of information from like well-meaning people, or people were telling you no, or I don't know what to do next. I'm just curious how your experience of advocating for your own health, and now of course, many, many other women, has shaped who you are as, a woman personally and as a professional today.
I think this whole experience has made me so compassionate for suffering on a level that I that I would never believe I could feel for other people. I'm a pretty compassionate person. That's why I'm in healthcare. I want to help people, but this can really be a life altering. It can going through hormonal changes that just take over your mind and your body. They can damage your relationships. They can, put boundaries between your kids. They can make it hard to do your job. It can be just so life altering. And the compassion I feel for women that either think this is just the way it has to be. I'm getting older, which is often what they're told. You just don't handle your stress well enough, or this is just part of aging and you need to
Yep.
accept that type of thing.
So true.
Yes, and women walk away thinking, "Wow, this is it." A slow slide into just not really mattering anymore and not being having that level of participation in your own life. So my heart hurts for women that don't have access to somebody who wants to be on their team and to lift them in this way. And then the other thing is I also feel compelled to share my experience because it was so my life was so great, and then it was so dark, and then it was so amazing, and it can be that way for every woman. She can feel like herself again and be herself again. You can't turn back the clock. We can't, prevent aging, but we can think like we did, we can feel like we did, and we can be excited about life like we were. So I want that for every woman that can hear my voice and your voices, even if I'm not the one that provides the care, which of course I can't. we're only one person at a time, but we can get the message out there that to advocate for themselves, that there is hope, and educate so when they do talk to their beloved care team, that they can sit there together as a team and decide what the best path is, as opposed to being told what they're going to do or not going to do.
I love that you said that because when I went into my PCP, who happens to be a male, wonderful person, wonderful gentleman, great guy. But I literally, I felt like, I'm like, I promise you, I'm not like running around and doing anything. I just start sweating. I just start sweating. Like I was trying to convince him that I was having a hot flash because in my mind, I wasn't sure if he would believe me,
Mhm.
which was my own like personal experience. Like, I never had experienced it before. I wasn't pre-warned. I knew it was coming, but I wasn't 100% well-versed in what was going to happen and all these changes that could have happened. And, he didn't divulge all the other additional items that could come with the hot flash, like sleep and things of that nature. I just thought, I'm like, oh, maybe I'm just drinking too much caffeine. So I think it's so important there are people like you out there willing to help others and listen and really listen and me and in my case believe. But I think your journey is such a testament to the idea that our personal muck can become the soil for something really beautiful to grow. I'm personally very moved by your commitment to making this expertise very accessible. I would love for you to tell us more about Thrive Midlife Medicine and the resources that you offer for women who might be feeling exactly how you felt a few years ago, or in my case, just recently.
So, Thrive Midlife Medicine has been created with the idea of education and access. There is a lot of online clinics these days for all kinds of things, and I absolutely love that because I think it expanded access is great, with a couple of caveats. They most providers and clinics and practices in this space working on a cash-based business model, which I thoroughly understand. Working with the insurance companies is very frustrating, very difficult. And if there's any way to get around it, folks would want to. And I just felt compelled to accept insurance for the reason of access. There's plenty of women who have plenty of money, and there's a lot more that don't and cannot pay cash for a specialist. So that's the first thing that makes my practice somewhat unique, at least on the telehealth platform. I want it to feel like you have this exceptional high-level specialist in your corner and easily accessible. You don't have to leave your house, and you can use your insurance. That makes me smile. So that's the first piece that is significantly different than most other practices out there. And the second is my philosophy of this shared decision making and having it be teamwork. The vast majority of the appointment is the patient telling me what is happening to her and and then how it's affecting her, and then what her goals are. So it's a lot of listening, and which is so important. Everything we all know about hot flashes, but there are just so many more symptoms that you folks may or may not even associate with perimenopause. And some are just a little irritating, like itchy ears. And there's others, brain fog. That is, you can have to step out of the workforce because you just can't think as clearly anymore, or your relationship is really going down the tubes because physically your body isn't functioning sexually like it did before, or you just have zero libido, and partners can become very rejected. So there's just things we don't necessarily associate with perimenopause. So it's a lot of listening, and then it's talking about the options, not a single option, not what my bias is or what I'm most comfortable with, but explaining what the options are for that particular person, because we all have health histories and we all have things we're comfortable with, even once we know the options. And then together coming up with a plan of care, and then close follow-up to ensure things are going well and a woman is just transforming into or back into herself, or maybe even an elevated form of herself, which I have seen countless times. So those are two things that are, I think, significantly different from either the regular brick and mortar doctor's office, primary care, that deep level of understanding and connection and shared decision making as a team, and then also the convenience of the telehealth platform and the cost piece of being able to use your insurance.
Well, kudos to you for providing a service that you're trying. I know it's so hard with insurance and just with your whole industry. I can't even imagine, but trying to make it accessible to those who are really in need of some education, normalization, and treatment for something that I think oftentimes is only available in like a concierge practice situation from my personal experience. And to make it something that is a conversation and you're including your patients in the decision-making process is probably so empowering for them. So I think that's incredible that you're doing that. And it's really cool to see how you've bridged your clinical expertise with such a heartfelt mission. And you're really providing a service that is so needed right now. And I mean personally, like as we've both shared, we're going through a lot of this ourselves. So I'm like, you can't see me, I'm nodding my head, I'm like shaking my head like, yes, I've experienced that too. And I just think it's so important that there's more education and insight and awareness and less shame around this whole stage of life. So it's awesome what you're doing. So thank you.
I love that you just said shame at this stage of life. That word is so powerful, and I think it's very pertinent in this discussion. The generation, I think, before never talked about their age or what was happening,
Mm.
it's as if it was a moral feeling that we get older and become go into our non-reproductive years as opposed to the most important and reproductive. It was a shame, and a woman coming into my office or to my telehealth platform, I do both, feeling like they've failed because they've tried harder and harder. I will eat less, I will move more, and still they
Mm.
gain weight. I'm trying, to manage my stress, but I still can't think. I'm snapping at my children. I'm rejecting my husband.
Right.
Just on and on. And honestly, the vast majority of women, they blame themselves that somehow they have done something wrong and failed
Mm.
and have shame to have to come ask for help. And I hope that this time in our lives where this conversation is becoming more common, that goes out the window. Because when other parts of our bodies, are not working right, we just go in and get them tuned up.
Yeah.
Our eyes start to go and we go get glasses. What
Mhm.
is the shame? Blood pressure goes up, have a blood pressure pill, and you didn't do anything wrong. And we don't look at this that same way, and it's very tough for so many women. So thanks for using that word. I think a lot of women it will resonate with.
Yeah, absolutely. And I mean, I so appreciate what you're doing. And I think the more this conversation is shared and the more it happens among more women, I think the less shame there will be, the more understanding and the more validation and normalization of and appreciation and celebration of the stage of life too.
Mm.
um, I'm curious what you would say to our listeners who are maybe either sitting in the doctor's office feeling unheard or like they don't understand or or someone who is having a hard time maybe advocating for her own body or questioning like what is happening and why.
I have a couple of answers to that question that come in, the best, the second best, third best, but whatever resonates with the woman listening to this. The I love primary care. Family medicine is, where I started and my heart. And we all know somebody in our life who is our trusted provider. So if you can start there and hopefully that person is open, even if they don't know about this area of medicine. And in case people don't know this, family medicine is a really, really, really tough specialty to be in because you're expected to know enough about everything without being a specialist. And we just can't know everything about everything. That's why you have all the different, you have an orthopedist and you have a podiatrist and you have a dermatologist. They're specialized. But so family medicine, I just want to say, is amazing and it's really hard. But if somebody does have a trusted, beloved primary care person to go in and have this conversation, and test the waters. This is what I'm wondering is happening. Can we talk about this? Hopefully, this woman would come in with a little bit of understanding of what could possibly be related to hormones. So she's not just, going in without eh, without having a broader mind that it can be more than just hot flashes. So that's the first thing. Luckily, there is a lot of information out there right now that can help lead that conversation. Advocating for yourself in the doctor's office can be really, really challenging, even when you are a powerful, woman, because there is that gap and that power difference. And if somebody says, no, no, that's not how we do it, or no, no, I don't do that, or you don't want to do that, that's not good for you. How do you push back? That is so hard. And so that's why I think these conversations plant the seed. And then there's fabulous books and podcasts and speakers and social media. Stick with medical people if you're going to have medical conversations. But so that's the first place I would start. And maybe it'll work out perfectly, or maybe you'll have to go to somebody else. Like I had to go to 4 different people, which I don't want that for anybody, but that is a possibility. And the second is to just take that next step to seek out a specialist as you would any other type of specialty in medicine. If nothing else, just to be assessed, know what you are a candidate for, and you can take that back to your primary. That has become slowly and then quicker a really big part of my practice. I don't I don't have to prescribe. We don't get we don't get paid for prescribing. S I would love to meet with a woman, have that deep dive, that full assessment, and then write down what my recommendation is as far as any labs that are gonna be drawn, what medications, what doses, what cadence of introducing these, and bring that back to your trusted GP. That is fabulous, and I have I have seen in my own practice that they're usually really, really receptive to that. So I know it's an extra step, but again, just like any other specialists, you go see them, get the recommendations, and your primary then writes the orders quite often. So it's the same thing. It's just understanding that there is another type of specialist that you might need in your life. And then the third is just changing your care to the specialist, and which is okay. I never want to overcomplicate a woman's life. We don't need yet another doctor's appointment, but this is such an important and impactful part of a woman's life that if she does need to add that one more layer of providers, that is the third option that I would recommend.
Thank you so much for all that advice. I wrote all three of them down because I want to make sure we include that information. I think one, definitely being your own advocate is so important. And like you said earlier in the interview, you only know what you know. And I think it's great advice that you're sharing to seek a specialist in the field if they're needing more care or more additional care. And then kind of collaborating with their GP. So you are coming in as a team versus just going as a one-stop shop and then being like, oh, he didn't know what to do or what to prescribe or what labs to order. I think that is very sound and helpful advice. I just want to thank you so much personally for sharing your story, your expertise with us today. It's been so inspiring to hear how you've transformed your personal challenges into really a lifeline for women in midlife. And you are truly helping so many women move from just surviving to really, truly thriving.
Thank you. Thank you. It's the most impactful, heartwarming work I've ever done.
Yeah, we're so grateful to have you here. And, personally, I know since this is a topic that resonates with both Neelia and I really appreciate having you here. I might reach out to you privately for some telehealth. And on that note, we want to make sure that people know where to find you because I'm sure we have other listeners who are like, oh my gosh, I'm ready to reach out to her. I want her expertise. I have so many questions. And I know we will have everything on the show notes for those who are going to be looking at the show notes for our episodes. But I also would love for you to just share, just on the episode right now, if there are other ways that people can easily find you. I know you have a perimenopause quiz, for example. Just any of the best and easiest ways for people to find you.
Yeah, thank you for that.
Of course.
My website is thrivemidlifemed.com. On that website, there's a booking link. There's a link for a free consult to kind of like a meet and greet and see if we're a good fit as far as my philosophy and what's going on with you. So I think that's a great resource. There is the perimenopause quiz on there, which a lot of women really feel empowered by taking that quiz, that they're not crazy, or that, oh wow, maybe this is it. And so that can be really helpful, especially if then they go back to their own primary to continue that conversation. It's just a couple of minutes, and the results come back very quickly of what might be going on and what your next steps would be. And then we can be found on Facebook and Instagram and LinkedIn and all the socials like the rest of everybody else. We do have events, and depending on when the show airs, there may or may not be a live one, but we do have recorded events. And so those are classes, kind of a higher level. At this point, we might get more into the details later of picking a very detailed topic. But for now, it's kind of a higher level view of what's happening and what you can do about it and how to have these conversations with your own primary, and that can also be found on my website. So there's lots of great resources there, and I do appreciate you giving me that opportunity to offer that out to your listeners.
We so appreciate you, and we are so grateful for you joining us today, and so thankful that we were able to gain all this knowledge and share this with our listeners.
Wonderful. Thank you so much.
To all of our listeners, thank you for joining us on this episode of Transforming and Thriving. We'll be back with more inspiring stories on the first Monday of each month. Please follow us on your favorite podcast app and follow us on Instagram so you can be a part of this community and stay up to date with each episode. Please feel free to leave a review so that we can get your valuable feedback and other people can find these powerful stories. Check out our website as well at transformingandthriving.com. We're all in this crazy life together, so let's move through it together. See you there.